Hi, and welcome to Mindful, Beautiful, and Thriving, a podcast series by Tharaka Foundation focused on youth mental health. Before we begin today's episode, I just wanted to let you all know that all content that is found in our podcast is created for informational purposes only. This content is not intended to be a substitute for professional medical advice, diagnosis, treatment, or therapy. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition, and never disregard professional medical advice or delay in seeking it because of something you have heard in this podcast. Thank you so much, and without further ado, let's get started.
Hello, everyone. Welcome back to another episode of Mindful, Beautiful, and Thriving. It's your host, Punam, here with an incredibly special guest, Neelam Patel. Today, we are going to talk about OCD, Obsessive Compulsive Disorder. Welcome, Neelam. I'm looking forward to talking to you. Before I ask you a few questions, please introduce yourself and tell us more about you and what are you doing currently.
Hi, Punam. Thank you so much for having me here today. I'm very grateful I could be part of this podcast and this topic. And to tell you a little bit about myself, I am a mom of 3 children. I have twins that are 11 and I have a 19-year-old. I reside in New Jersey. I'm right outside of Philadelphia and I'm originally from Chicago, so that is actually my home. And I've been with Cisco for about 9 years, always been in the services organization. And within Cisco, I am in our global services sales organization for the past 2 years. So it's a global role, but okay. And so I think for this topic, I'm very curious on how I can help.
Thank you. Thank you, Neelam, for sharing more details about you. So, for those who don't know, what is OCD? Just simple definition, if you can explain your perspective, that would be helpful.
Sure. So, it's interesting. So, first of all, OCD is a disorder. It is a mental disorder. It can be long lasting and something that's not temporary. I've also heard it's something that can be hereditary. But essentially, it is a disorder where someone has uncontrollable and recurring thoughts. And as a result, they engage in like repeated behavior, repetitive behaviors. And so it's, there's like an obsession, which is the uncontrollable thoughts. And then there's the repetitive behavior, which is, considered the compulsion. And before we go into more detail, it's something that we often hear that, oh, you have some OCD, or it's something that's sometimes taken lightly. Even I have said that myself, when I feel like a need for something to be like neat or organized. And it's interesting, my husband, I always used to tell him that he just seemed very OCD about some things because he would fixate on certain things. And I think going through this experience that we'll talk about, I have realized that, I think he probably was undiagnosed, but I think he definitely had some OCD. It didn't necessarily impact his life like I will share that I went through with my daughter. But, that's the definition of what OCD is. And it can vary from mild to very severe.
Thank you, Neelam, for educating us. So you mentioned your daughter. You noticed something in your daughter, right? So what behavior did you notice in your daughter, and how old was she when you noticed those behavior?
Yeah. So my daughter was about 11 years old when I first noticed some change in behaviors with her. It not so much a change. It's something where her behavior just seems a little abnormal. And the behaviors that I saw, so in my family, we had a lot going on. First of all, and something, that causes stress. We had a very stressful situation going on where my husband, he was a physician. He was diagnosed with a very serious illness. And I think when we were going through that, what I started to notice was that my daughter was washing her hands like a lot. And, I remember specifically we sent her and her grandfather they went to Texas, the two of them, and she just seemed very upset, emotional, and then she was washing her hands a lot. I remember my sister-in-law telling me like Naya just like washes her hands all the time, and it's just a little odd. And so that was that. But then what I really noticed was shortly afterwards, as my husband progressed his illness and it was, getting serious each month, we took a trip to Disney World. And when I was there, I noticed her asking a few things all the time. And I think maybe I noticed it more because we were out of our home element. We were somewhere else. And I had, four kids, just me. And so I really needed all of them to kind of like, we all needed to pack together and stay together. And what I noticed her doing was a few things. One, she would ask me ongoing, like every few minutes, Mom, am I okay? I just remember that. Mom, am I okay? And my first thought would be like, yes, you are. Of course you are. But that was causing her stress. The other thing that she kept telling me is she said, Mom, I have to check. I have to go check if she forgot something. And that was a behavior that was the two things. Mom, am I okay? And the need to check on things, wherever we were at, if we were in the room and we were heading out, she had to go back and check if she got all her stuff. She had to check if she had her backpack. She had to check if she had this. There were a few times that, we almost missed her on the bus going from Disney Park to another because she ran back on the bus going to check if she left something. And so those were some behaviors that really stood out for me. And I thought, something is really different and something is off. And I remember that time I felt it was slowing her down. It was slowing all of us down. I felt like she had a lot of anxiety. And I remember calling my husband, while I was there at the trip, and I felt, I shared it with him and I just said, I don't know, something feels wrong. And we thought, okay, when we get back, let's figure out what to do.
Okay, wow, very interesting. So, what did you do after noticing those behavior after calling your husband? Did you try to explain to her something? Did you tell her, like, we need to get professional help? How did that conversation happen?
So two things. One is I definitely talked to her once we got home, when we were back in our home setting and things were, we weren't at some big park and it was a little quiet. We were kind of in our normal space. And I just asked her, when we were at Disney, you kept doing these things. What were you feeling? And she basically just said that she felt like she was forgetting stuff and she felt like, she had to check on things and it was really causing her stress. And she felt scared. And so I just said, I'm not familiar of how to do this. Like mommy was trying to help you and you seem like it still wasn't helping. So, maybe we can try to find somebody that we can talk to. And so, she was 11. She wasn't totally against it. I don't think she really knew. I needed to take kind of charge and what the next steps were. And, I explored looking into counseling from there.
Okay, that is helpful because sometimes we do hear kids they have resistance, they don't want to take any external help, but looks like your daughter was open to taking professional help. So, did you finally find a good professional help for her?
Yeah, so you know what, you bring up a good point. At her age, she was okay to doing it, but when we were going to counseling, she really was frustrated because, we had to take time to drive to go talk to somebody. And her initial thought on that was, this is a waste of my time. I don't understand, why this woman is asking me all these questions. And, what I learned is we had a lot going on at the same time. So, while we were getting counseling, I don't think it was the right type of counseling. Because we had too many things going on, which was my husband was, very ill. I think the first thing that, a counselor assumed was, okay, this child is, dealing with a lot of stress, and, let me talk to her about that. And I believe her OCD was not diagnosed early on. And maybe it's because it was not able to be, but, for all the behaviors that I was seeing, it was kind of, it was mixed up in all the other stuff that was going on, that it went undiagnosed. And so early on, it was actually ineffective. But what happened is, essentially after a few months, we had a really hard time, even harder, because my husband passed away. That was not expected. And so from there, things got worse. We were now dealing with grief, a lot of stress, and, the OCD, which what it was, and we didn't know it was OCD because it wasn't diagnosed properly. But that actually got like 10 times worse. And I think at that time there were a lot, the behaviors that I talked about turned into, they just like escalated into a whole bunch of more behaviors that really, really made it very hard. It impacted her life in a way that it took hours for us to get through a day once she came home from school. And at that time, I think there was too many things. I completely thought, oh my goodness, like something is terribly wrong here. I don't know. I need to find some new help because whatever we've been doing has not been working. And from there, we actually saw a psychiatrist. And I think that is what we needed to do first, which we hadn't done. We went more to a therapist. And so the psychiatrist diagnosed her as OCD and recommended her to see an OCD therapist. And from there, when we first saw the OCD therapist, I think my daughter felt, okay, this person understands, like she's describing what I've been feeling, what I'm going through, spot on. And I think right when she thought that, she thought, okay, you can relate. She got the confidence that the therapist knew what she was talking about, and she felt she was being heard and she was being felt. So that completely changed her kind of buy-in on that. And she felt like she needed help at that point because it was really negatively impacting her life.
Wow, Neelam, it seems like you and your family has gone through a lot, and I'm really sorry to hear about your husband. But I'm really admiring your courage to share your story and taking care of your three children. And looks like that you have a lot to share with our audience and some of the valuable lessons. One therapist might not be working, and as you were sharing in the beginning, that therapist might have misdiagnosed, or she was not, or he was not meant to understand. And it
Yeah.
took a while for you and your daughter to find the right person to relate with, to have that confidence, have that trust. So definitely, it's like my learning is, if I ever need a therapist, and if it is not working with for me, it's okay to change. It feels
Yes.
like, yeah, the dating
Yeah,
experience, right?
absolutely. Absolutely. When I looked back after that experience, I was mad at myself for not realizing that earlier, but, I have to be gentle to myself. We were going through a lot. But as a lesson learned, yes, I would 100% think if I'm not seeing some sort of, positive change, within one or two sessions, then you know what, find somebody else. I think in my case, the psychiatrist is who I would go to if I ever thought there was some sort of mental disorder. I would see a psychiatrist first and get some sort of diagnosis, see what the psychiatrist says. I had not done that the first time around, and I wish I had.
With Neelam, you're educating our community, you're telling your story, we are learning from you. So it's okay to, like give some time because, things won't work overnight, right? As you said,
Yeah.
guidance is do take 1, 2 sessions, give some time, and if you don't see any positive change, it's okay to change. But I
Yes.
wanted to ask you another question.
Yeah.
Sometimes parents, we do ignore, but in your case, you did not ignore. You rather, took step and you provided the right help. So, what is your message to all the parents who are listening to this podcast today?
Yeah, you know what? That's a really good question. And, look, I have often heard, like, we hear about a lot of things. We hear about, uh, you know, more suicide, depression. You hear of all this, especially with youth, right? And, even depression, this is a different topic, but sometimes when you're not familiar with it, it's hard to relate as to how painful or how agonizing or how hard it could be for a person who's going through that. I don't think I really understood that type of pain until I went through this experience. And, seeing your child or anyone that you love with something like that, like mental health is a real thing. And when that is, there is some struggle there, it can be, we may not see it or feel it or hear it because somebody may not talking, but on the other end, the person who's going through it, it could be so unbearable for them. And, unless I hadn't been going through with some of them on trying to help my daughter, and sometimes I didn't know what to do of how to help her. So, often I would just reassure her. So reassuring in OCD is actually not what you want to do. It only makes it worse. I didn't know that. But I think the whole thing is that professional help is needed. And it is, what I saw is that it was very, very unbearable for her. And that, like, one, it broke my heart. Two, I felt like, what can I do to help her? Like, I have to help her get through this. My worst fear is, you hear of suicide and anything. And I just knew I had to do something because I needed to stop it from getting worse. And it was really detrimental at that point. So, it's just important to take action early. Because in this case, it just got worse with time, right? And when I say worse, it's worse in many ways. Behaviors get too hard. And for the person that's going through that, it's an agonizing kind of pain, which no one can really experience or feel. But, just listening to her and her telling me, and of course she talked with me, I could sense her pain.
Wow. So, Neelam, how much time did it take for her to feel better after, meeting with
Yeah.
that psychiatrist?
I think once we got the diagnosis, we got the OCD therapist. I mean, huge weight. I think within 2 months, first month, like I think every session we went, and we went weekly. So two things. One is we had sessions, therapist sessions. We also had, like, my daughter went on medication, and, it was like we were in a place where we needed, like, whatever was going to be easier because it was so, so hard. So, we started medication, and that was, that all usually starts low dose, and, you kind of try to see how much it's helping. But we started meds and we started the therapy, and we went weekly. And I felt each week felt a little lighter. And it just, and when I say a little lighter, it's like you just notice something. Maybe it's just because somebody knows what, we have like an action plan, and we were given tools to just how to handle. And so just even having that small thing of, once I go home from the session, and when this happens, how am I as a parent going to help handle? And my daughter, how is she going to handle, right? Because now she knows that this OCD therapist understands what she's going through, and it's coming from her. It's not coming from mom. It's not coming from someone who doesn't know. I'd say 2 months, and it was like a huge weight lifted. And then from there, it took a while. I feel like it took maybe about probably a year of ongoing therapy to really, really, kind of get a toolbox, and understand how to handle, and it made it go lighter a lot.
Okay, Neelam, that's good to know. But another question is coming to my mind. Is she still meeting with her therapist, or she is like now leading a normal life without any OCD?
Yeah, that's a good question also. So I feel like, you know what, the first year, and this is many years ago. This is when she was 11. She's 19 now. The first year it was ongoing, right? It was just like weekly, weekly, and then it turned on to bi-weekly. I'd say like after, a year or two, then it was like twice a year. We would just have check-ins, or maybe it was as needed, because of something that's happening. And she would feel that, I think she would actually come to me and say, Mom, I think we need to meet with, the doctor, the therapist, because I feel like it's a little harder. So we would kind of go as is. And I'd say for like the past 3 years, maybe 4 years. I feel like it's been much more normal. And I mean, she's at college now. She hasn't seen her OCD therapist maybe for about 3 years. It's been a while. Maybe just during the pandemic was maybe our last. Um, but she does see her psychiatrist because she does continue the meds. And so she does continue to see the therapist, as a result.
Okay, okay. So another question is coming to my mind, that open communication channel, right? So I'm glad you are there for her. You do listen to her and she shares with you. So do you have any message for all the teens who are listening to this podcast?
Okay, so for the teens, I think it's just, talking to your parents. My daughter was very close. She just had me. I think she would have talked to her dad. He was a doctor, but she had me, and so she would talk to me, and we have a very close relationship. So I've always told her to let me know what she's going through, or if something was harder. But I think the key is that, uh, you can always get help. And if you're not sure what kind of help, lean on your parents to find that type of help, and really just go from there. I think that's a key, because there's people that can help you, and there's no reason why someone should have to suffer from some of those, the hardship that comes with mental health, challenges, because they can be so painful and so hard.
Yes, Neelam, thank you so much for sharing your story. I learned a lot, and as you were saying, finding the right mental health care professional or support system, it's not that easy, but hey, we are here to help each other to make that progress every day. And we need to have a lot of patience, right? Encouragement,
Yes.
as you did. I mean, it was like not easy journey, but I'm so thankful to you for inspiring many, many more people
Oh,
with your
sure.
story.
Yeah, if I could just add one thing, you know what? Just in terms of, it depends on age, but I was going to say, I think the last question was kind of for somebody who's going through this, specifically for teens. I would also just say that, for anybody, if whether it's a parent or family member, that has, someone in their family that's going through something like OCD or something. The one thing that I did learn is, to your point, Punam, you said patience. Patience is definitely needed. A lot of love is needed. But the other part is to not take anything personal. What I noticed with my daughter when she was going through this OCD is it was not her that was stuck in that. It's like, I often refer to it, and we learn this in the therapy, but it's kind of like it's like this OCD monster, like this other thing that is in the mind. And she could sometimes, because it was so hard, I could try to help her. And if I wasn't doing it the right way, or if I had followed a technique that our therapist had, kind of said, like, do it this way, and then, leave it at that. Sometimes we had to negotiate, my daughter and I, because she really needed some reassurance, and it was so hard for her. So we'd have to negotiate. But sometimes she could say some mean things to me, and it wasn't her, right, that's talking. It's because she's going through this pain or this agony of this repeated, this obsession, right, that's uncontrollable. And so what I would tell myself is, and anybody who is going through this in your family, is not to take that personal. It is not your child or your parents talking. It is this disorder that just needs some help. And and that's one thing that I learned, not to take it personal.
Wow, Neelam, that's such a powerful message. Thank you. Thank you so much again for sharing your story with us. Thank you.
Sure. I'm so glad. Thank you, Punam, for the opportunity.
You are listening to Mindful, Beautiful, and Thriving, a podcast series by Tharaka Foundation. As part of our youth series, we will be releasing new episodes every Friday, so make sure to continue to check those out. We hope you enjoyed this podcast, and thank you so much for listening.